everyone, welcome.
Hi, Amy.
Hi. I'm Amy Angelo, and I am a franchise business consultant with Care Patrol. And our topic this month is memory care. And so we brought together two of our experts here who happen to be two of our national provider partners that Care Patrol works with. And they will be sharing their perspectives on what their communities do and their expertise in the area of memory care for seniors. We have first Paul Vranesic. Did I say that correctly? Vranesic?
Vranesic. Close. Very close.
Okay, sorry about that.
That's
yes,
okay.
and for Paul is from Medica and Arden Courts, and he's the Divisional Director of Sales and Marketing, covering 56 assisted livings and 200 skilled nursing facilities. And thank you for being with us, Paul. And then we have Joanna also here, who is Senior Vice President of Care and Life Guidance Operations for Atria Senior Living. Thanks, Joanna, for joining us as well.
Thank you.
So I guess I'll kick it off with just a question that I think comes up a lot from families when you begin these conversations with them, when they reach out to you. Joanna, would you like to begin?
Yeah, absolutely. I think that the number one question that adult children struggle with when they're trying to come up with approaches to taking care of a loved one that has a dementia diagnosis, either a recent diagnosis or a family member that's been working through having a loved one with dementia for quite some time, is this the right time to make a transition into either an assisted living setting or more specifically into a secure dementia neighborhood? Mm-hmm. I think that folks really struggle with encouraging for mom or dad to leave their home that they've been in for a considerable amount of time, and them making that determination, is this going to be more disruptive to mom or dad? Am I going to see their disease get worse with this transition? And then I think that there's also just stigmas that are associated with institutionalization. And I think folks still continue to this day really struggle with it, despite the fact that the data supports that for individuals that are suffering from dementia and other cognitive impairments, that socialization is a huge component of being able to maintain their level of functioning.
Yeah.
And so I think, the biggest conversation that we typically have initially with family members is like, what does mom or dad's day-to-day look like? Are they out there? Are they still engaged? Are they able to perform normal daily functions and activities of daily living safely? And are they able to still appropriately manage their medications? And so all of those things kind of come into play when folks are trying to make the right decision about whether or not it's time to make a move. And I'm sure Paul can add to that as well.
Yeah, those are great points. And at Arden Courts, our memory care advisors face a lot of those, similar questions from prospective families, especially the adult children of a potential loved one that will become a future resident. Mm-hmm. I think, one of the other tough challenges and questions that families ask obviously centers around cost of care. And so there are different, pricing structures out there within the different communities. And, also, again, to piggyback on what Joanna said, is this really the right time to move mom or dad from home or whatever their current living situation is into a community? And what level of care really is the best option for them? And so, we coach our teams to educate them on the disease itself and what that progression will look like. We know that dementia is a progressive disease. It doesn't get better, it does get worse. And so I think being honest and open and upfront with families right out of the gate really sets the tone for a more thoughtful conversation about what the right next step is.
Yeah, I wholeheartedly agree with that. I think to just understanding and supporting families and understanding the dementia diagnoses, yes, while it's a scary thing that they have to embark upon, everybody's progression is a little bit different. There's so many different forms of dementia out there as well. And so to Paul's point, really empowering our sales folks, empowering our clinical staff to understand that everybody's journey is going to be a little bit different, and they have to look at the individual holistically, as opposed to just singling out that one particular diagnosis.
Yeah. I heard the timing of the move. When is the right time? Seems to be like the overarching theme, because I'm sure families don't necessarily want to put their loved one all the time into a community if they feel they could continue to care for them at home, or provide some type of additional care in the home. So that's good to hear that you're really working with the families to advise them and to help them understand some of the things that will arise, and what type of care you are able to provide them with to keep them safe. I'm curious, like, when does the cognitive impairment become too much, perhaps, to manage at home? And does that play a role in the timing?
I think the unfortunate reality is that a lot of times folks end up in a sort of crisis situation, and that's what's prompting the move. It's difficult when, you've been in your home for 30 years, you have a routine. And so sometimes it's very difficult to pick up on those early indications that folks are starting to suffer from more short-term memory loss that's impeding on their ability to safely care for themselves. Or if they do have in-home support, is it a sufficient amount of supervision? And so I think, when you're looking again at these individualized specific circumstances, you really have to look at, like, what are some of those warning signs that are starting to flag up? Mom isn't eating right anymore. She's leaving the oven on. And I think personally, from my experience, and Paul can his experience as well, but I mean, we do see that meds typically play a very large role in this, and people forgetting to take their medications, or maybe they're not taking them appropriately. And unfortunately, that typically is what the prompt is. And, these individuals end up hospitalized. Yeah. And so when we're getting called, again, it goes back to that crisis situation. And, it's difficult to sort of unravel, like, the difference between their true cognitive impairment versus what some situational circumstances may look like it's presenting worse. And so that's where you really have to be able to have a clinician that can ascertain the difference between dementia or a mild cognitive impairment versus delirium. Because when you're going into a hospital setting in these crisis situations, you're sort of combating an individual that's been woken up multiple times. They're not in their comfort setting. There's med adjustments that are happening. And so, I think families always want, like, a very quick response and an explanation to what's happening. But the challenge is that if, say, for example, you ended up in a hospital because of a UTI that resulted in a fall, it's this cascading effect. We sort of have to back our way into it to determine, was their cognitive impairment truly, the reason for this, or are there other things that are happening as well, just through the general aging process?
I'm glad you mentioned that. I'm glad you brought that piece up, because that was a question I was going to ask was, is memory impairment ever temporary? Right. And I think touched on that a little bit, right, Paul? Do you? Yeah.
I mean, I defer to Joanna. She's a clinician, so she probably sees it more than I do. But there are examples that we can cite where someone develops, let's say, a severe UTI, or they go into a surgery and they have anesthesia and they come out with some type of forgetfulness or disorientation. Those examples do happen where someone will eventually come out of that state and return to normal function and normal memory function. So there are some examples, and maybe Joanna can cite some more, but to your original question about families being unsure if now really is the right time. I just had an example. I was just working with a family recently in one of our markets, and she was talking about, well, I'm going to wait until safety is really a big issue.
Yeah, we hear that a lot as well. Yes.
I'm going to wait until they forget my name. Well, why would you ever wait for a crisis? And unfortunately, we see this too often in the senior living industry and in the healthcare industry in general, where we wait to go to the doctor, we wait to ask for help, till it's too late, and then crisis occurs, and then we try to react. Rather than that, we recommend people be proactive. And even for the people on this call, myself included, get your memory checked. Go see a doctor. Have that screening more often. And maybe what we will do eventually is break this stigma that about this disease, and hopefully people will be more comfortable acknowledging, hey, I might have an issue here and I need to get it addressed.
Yeah, that's huge. Thank you for that as well, because I think society needs to do we need to be better at accepting aging in general and all of the diagnoses and issues and challenges that arise when we age, and often memory care is one of them. And I know my parents' generation, my father had dementia. They didn't talk about it. It was just, oh, Dad's a little forgetful. And, there was really no need to go to the doctor to see somebody about that until it became a huge issue. And I would love to see, just a society that was more proactive with testing, with knowing the resources that are out there, with reaching out, having a healthcare system that really just supports memory health and aging in a healthy way, so
and I think we see that stigma too, even within senior housing, generally speaking, because it's not just that initial move to get mom or dad into memory care, but if they've done the initial transition just into assisted living, generally speaking, and they've been a resident with us for a long period of time, and then there does start to be some safety concerns on our end, exit seeking, increased difficulty being able to order off of the menu. It's hard sometimes because families really grapple with that transition over to a secured environment. And I think that in assisted living in particular, in senior housing, strong geriatric partners, and really leveraging relationships with true geriatricians where they look at, every single component of the aging process as opposed to just one select specialty makes a world of difference.
That's a good point. I know in the state where I used to live, we worked very closely with two strong, large healthcare networks that really emphasized testing in seniors and wrapping services around them, and just getting them connected to all the supportive services that they would need as their diagnoses progress.
Yeah, I think one thing families have to look at beyond the four walls of the communities that they're searching for, and beyond the fact that there might be a locked door or a secure door, is understanding what's behind that door and what is offered from a memory care perspective. There's so much more to memory care than just being a secure community and providing that level of safety. There's engagement through programming. There's the way that the care staff approaches and communicates with residents. I mean, there's a lot more to memory care that most general consumers don't quite understand. And really that's on us as, senior living experts to help explain that to them and guide them in the right path towards the best decision for their loved one.
That's why I'm really grateful that we have such great partners that we work with Care Patrol works with, because we get that education from you also, right? We're always asking you, how can we best work with our families? And, we're certified senior advisors, so we have an understanding, but then just to understand how each of your communities address care needs and different programming that you do, and to really find the best fit for our clients. I wanted to ask also, how does a family choose a community? That's not just for the short term, but as their needs progress, and you might have said like getting into an assisted living first, but is there certain specific things that you feel they should consider when choosing?
Yeah, I mean, there's a whole host of factors that families will consider. Again, I'll go back to pricing. Pricing is always, cost of care is always a question that families will ask. And so understanding what assistance also might be available beyond any type of private pay funds that they may have is really important. So veterans benefits is always good to look at if you were a veteran in duty situation. That's always good to explore. Is there a long-term care insurance policy? That's another form of finances that may be available. Certain states also have some type of Medicaid waiver program that can also assist with cost of care. So you really have to look at the big picture from a financial standpoint and see, what best fits your own personal needs. I will say this though, when you look at the full spectrum of care throughout the entire industry, I really think, Joanna will probably agree, we've got some great leaders in this industry, Atria, Arden Courts, a lot of others. There's some really strong leaders in this industry that are on the forefront of evolving and making assisted living, memory care, the way of the future. So it's really important that we as an industry continue to adapt to the needs of our customers as well.
Yeah, and I think, Paul, you bring up a really valid point. It's, as operators, we have to be prepared that it's a forever evolving industry. So, again, perfect example this week, we got into a dialogue internally about the difference between something as simple as activities and engagement. And it sounds like semantics, but it really does kind of alter the approach that you take in memory care. How do you keep your residents engaged socially? Because sometimes just activities are too overwhelming. And, to Paul's point, I think it's recognizing sort of what happens behind those doors, but then, keeping up with trends from nutrition to advances in medication, recommendations about socialization efforts. And so I think you really do want to feel comfortable that you're working, as a consumer alongside a provider that is a little bit more forward thinking, and is sort of able to speak to some of the adjustments that they've made, over the last several years as more research becomes available to us. I think a huge part of it is too, and we'll start to see more stuff coming out of, post-pandemic, the implications that prolonged social isolation happened just through the force of quarantine, the impacts that had on cognitive impairment. But I think it's actually going to help guide us become, more effective and efficient providers and help understand how the disease manifests and how we can improve, as operators, just generally speaking, to attend to this very vulnerable population. But I do think that plays a huge role in it, because if you have somebody that's still operating in the same way that they did back in 1987, that might not be the best fit.
Right.
I think the other thing to just sort of take into consideration when you're looking at selecting a facility, regulations and licensure play a huge role in that. So the way Paul's buildings are licensed in some states could be very different than my own, which dictates and drives how long somebody can remain in our settings. And so, as the disease progresses, sometimes it goes outside of our regulations or how we're licensed to be able to retain that individual.
Are you able to talk a little bit about that and what that might look like? Terms because for those who aren't in the industry, we don't know what regulations and all that might even be.
Yeah, absolutely. So, each state's got at a minimum at least one regulatory set that is enforced by typically a Department of Health, Department of Social Services. And within those regulations, you have what's called your acuity and retention guidelines. So what can you admit into your buildings? What can you retain? And then what warrants a discharge into a higher level of care?
Okay.
So
levels of care, I see.
Yep. And different providers will tap into different aspects of those licensures as well. So using New York State as an example, within that state, you actually have 4 different reg sets and 4 different licenses that you can apply for, which is going to dictate, your acceptance as well as your retention of your residents. And then, the provider can almost in some states select like which services you want to be offering. And Paul probably has experience with this because of he's working for an organization that's a little bit more of a CCRC continuum. So people have the ability to progress into different settings that operate underneath different regulations, whereas as Atria is a standalone assisted living. So we don't have that skilled nursing component, which I don't want to say limits, but it definitely places some additional requirements on, who we can accept, who we can retain. Is it more of a Lewy bodies type dementia where there's going to be behaviors that are involved, or is it going to impact the individual's mobility? And so those are all questions that consumers really should be asking operators at the time that they're, touring these communities, because it is going to have a large impact on, somebody's longevity within a community specific.
That makes good sense. Yeah, I could see that, like the given the diagnoses and the progression of it, and what kind of care are they going to need in the future, and can you provide it in that setting, or will they have to leave the community completely, or can they just go to a different level of care within? Correct?
And that's why it's important that families and individuals become educated and really do their homework with the help of senior living experts. Working for a company that provides a very large continuum of care, and our assisted livings primarily focus on memory care. Our Arden Courts product, our tagline is memory care is all we do, and that's really been our main focus for over 26 years. But having a skilled nursing component on many of our campuses, having a home health care and hospice component under one umbrella is great. Unfortunately, not every company has that opportunity. And so, it does present some bit of a challenge to figure out, well, who do those providers then partner with? What quality of services do those partners then provide in conjunction with, the community that I'm looking at? And, I know, Joanna's company does a really good job of, investigating and making sure there's quality metrics met, as do, we, even in markets where we don't have our own skilled nursing provider or home health care and hospice, entity in a specific market. So it's really important for us as well, even though we have the continuum, to make sure we're making the right choices in who we partner with. And so that's really important for consumers to really ask those questions. Well, who do you partner with for physical therapy, occupational therapy, speech? Who do you bring in if you're short-staffed and you need a private duty aid? Or how do you manage certain behaviors with a certain diagnosis of dementia? And what type of psych services do you bring in to help manage those behaviors that inevitably, given any diagnosis, are going to pop up at some point during the disease process?
Yeah. And I think it's really important to acknowledge the fact that, there's so many different individuals that get involved in a resident's care, regardless if they're in assisted living, memory care, skilled nursing. You have to branch out. And so you get, to Paul's point, PT, OT, cognitive therapists, who's your geriatrician? And so those are all really great questions to be asking at the time that you're touring the community, because it really is going to make or break the services that are offered. Yeah. The other thing too that I really pride, our organization on, and I think Paul probably does the same, and he attested to this a little bit, is the simple fact that, we all specialize in different things, and, we take a lot of time in training our sales folks and our clinicians to be not shy of the fact of acknowledging that sometimes we're not the appropriate setting, but rather than just dumping it on a family and being like, sorry, we can't do this, offering options. And so it is the responsibility of the providers as well to understand their competitors so that they can assist these families, in coming up with alternative solutions. And it's the same thing when we have to transition somebody, into a higher level of care. Like, my nurses are not supposed to say, we just can't do this anymore, here's your notice. It really needs to be a conversation and assisting in finding alternative placements and offering suggestions. Like, here's the benefits of each of these different providers. And so I think that it's really important for, scouts, when they're in those buildings, to be asking, to Paul's point, like, what is the next step? How are you going to support me at this time if mom or dad are no longer appropriate for this setting?
Yeah, you mentioned just training of staff also, and gosh, I can imagine there is a lot of training that goes into providing memory care, right? It's very specialized, and I'm wondering if you could talk a little bit about what your organizations each do, from the training perspective, and what specific memory care training might look like.
Sure. Yeah, I mean, I can talk specifically to both our care staff and then also, our memory care advisors who are meeting with families, touring them, and consulting with them. So, from a staffing level on the front lines, our caregivers, our nurses, and even our administrative staff, they go through our own specific company-created dementia training, and so that has actually been nationally recognized and certified through the Alzheimer's Association. So we actually have that recognition as providing, high quality standards of training for our staff. And they go through routine training, not once in their career, but consistently throughout their career. We are providing it at least on an annual basis, if not monthly. And I think when you first step in Arden Courts, you're stepping into a world that's all dedicated solely to memory care. So, just being in an Arden Courts will give you some education and training right out the get-go. That being said, one of the things that has been a big focus of mine and a big focus of our company over the last 3 to 4 years is providing education and resources for the community at large. And so we make sure that our memory care advisors are experts in their individual markets, and that when they go host a support group or a memory cafe, that they are fully trained and prepared to go give advice and educate prospective families or the community at large, or other professionals in the healthcare industry about this disease. And I think it's really important to continue that education on a consistent basis, because as we know, things change, right? Things evolve. And so this disease evolves. The more knowledge we get, the more experience we get, the more we know. And it's important that we continue to share that information with everyone.
Oh, that's awesome. Thanks, Paul. Joanna?
And I think to add to that is, we really focus on ensuring, like, when we're reviewing incident reports, or if somebody has an updated service plan, making sure that our staff understand what we've assessed for, and how to appropriately provide support for activities of daily living. And so you have sort of these general blanket trainings that you need to complete, for state compliance purposes. Of course, similar to Arden Court, we go above and beyond. We offer quarterly in-services. And then we sort of pivot based on what the environment is dictating as well. But, I really think that it's important that you apply the trainings, the general trainings that are done, about the disease progression, techniques for communication, and adapt that to each individual specific resident. Because the approach that you take with one individual based on best practices may not work for another individual. And so it's really ensuring that these assessments are complete and accurate, and that your staff understand how to interpret them in each individualized experience.
I love that you said that. I mean, even it could change by the day.
Yeah. And I mean, even hour by hour, right?
Yeah,
like you can start to identify patterns of behavior. So empowering your staff on what does sundownings really mean. I mean, that's a big, a big conversation that we have consistently. And I think it's a term that's thrown around a lot, but folks don't fully understand, what that entails. And, Dad has recently indicated that time change, when we do spring forward, fall back, that's really difficult for folks with cognitive impairments to adapt to. So, proactively training your staff and understanding, hey, spring forward, you're going to be showing up to work an hour earlier, but just so you're aware, these are some of the things that our residents are going to be struggling with as well. And so you got to ensure that you're making all of these changes that we don't really account for on a day-to-day basis applicable to the population that you're caring for.
Yeah, like maybe they're not hungry at the time that they were hungry before, or they don't wake up at a certain time. So there's going to be a gradual adjustment. Whereas we often can just be like, oh, the time has changed. Now I just arrive at work at this time, and life goes on as we, it's a lot easier for us to adjust, even as practitioners, and in that setting. But yeah, it's you really, having taken care of my father with dementia, I can attest that you must be very flexible in your approaches, right? And you can't get stuck in one way of doing things because it doesn't stick, right?
It takes a lot of patience. It takes a lot of patience and understanding. And, at the end of the day, we're really living in their world because their world has changed so much beyond what our world is like day in and day out. And so it is hard for caregivers to adapt to that. It is really a struggle. And there's a lot of guilt and emotions involved. Their loved one isn't, essentially the same as what they used to be. And so how do we cope with that loss, and how do we move forward with the new reality that is this disease?
Mm-hmm.
Well, and I think Paul brought up a really valuable point about how challenging it is for the caregivers as well to watch these changes happen with their loved ones. And I think that, within the industry, we have to recognize that our customer is not just the memory care resident, but it's also the family members that are going through this. And, clear and consistent communication and updates about how their loved one is doing. It shouldn't always be a bad phone call that's occurring. You have to identify, like, there's a lot of wonder, there's a lot of concern, and so taking the time to just even place a phone call if maybe that visit that day wasn't that great because mom forgot who you were. I think that department directors in memory care settings really need to recognize the fact and own that I'm not just responsible for this resident that lives with me 24/7, but also, ensuring that their family members are understanding sort of what the progression is. And I think Paul touched on this very early on. It's our responsibility to educate as industry leaders. And so you really want to be seeking, experts within those communities to be able to help speak to what the experience is going to be.
Yeah, I imagine just when someone comes into your communities, just helping them anticipate and adjust and understand even the day-to-day of what's happening and being there for them as well. Like you said, they're the customer also, right?
Yep.
Gosh, and speaking of worlds changing, wondering if how your communities navigated the pandemic. Family visitations became difficult or not at all, and people were quarantined in their rooms, right? So if you could speak to that a little bit, just to help us understand, and then maybe what it's looking like now.
Sure. So one thing I just want to touch on is that it wasn't all bad, right? Going through it was very challenging, very stressful, but I think we learned a lot, through the pandemic on alternative methods of communication that can be extremely beneficial to families. Even once all of this is kind of in the backseat and in the rearview mirror, so yes, was visitation restricted? Absolutely. But, getting creative, FaceTime visits, utilizing and leveraging the telehealth to be able to continue to partner, with these medical professionals that support us. And so I think that there's a lot of practices that were probably implemented throughout the pandemic that will remain.
Mhm.
I will speak very candidly that memory care was challenging because, it was overwhelming to have to explain to residents why they needed to remain in their apartments. And there were certain states that, up until like maybe a month ago, didn't allow for family visitation. And so you really did have to navigate those dynamics specific to the individual, so that maybe a FaceTime visit wasn't the most appropriate, and a department head taking a picture and providing a weekly update or an every other day update to a family member worked better, because it didn't send your resident into this state of anxiety, not understanding why their daughter wasn't coming in to come and visit. But I do think through technology, so different methods of tracking disease presence, different methodologies for communicating with families, I think it's actually set us up to be more efficient and effective as providers. I also just have recognized the fact that, we have to understand how social deprivation impacts somebody's cognitive status. And how to appropriately provide redirection. And I think one of the big things that we struggled with initially was, our AL residents were able to express that they didn't feel well, that maybe they were starting to experience a cough. And so we had to come up with different assessment tools so that we could detect presence of the virus without having those verbal prompts. So just general malaise, fatigue, loss of appetite. And so we implemented a tool, throughout all of our memory care neighborhoods, where our staff were going in and there was a series of questions that they needed to evaluate. Does this individual potentially have COVID? Have they been exposed? Or is it just a general flu? Or are they just, struggling with, having to be confined to their apartments as best as possible? And what additional interventions do we need to put in place to address those? So, at the end of the day, and I know I'm kind of babbling a little bit, but I do think that some of the things that we learned from this whole thing will really set us up to be quite successful in the future.
Yeah, I agree. I'm seeing that just across all aspects of healthcare at this time, right? Paul.
Yeah, I like to always say that we became ninja warriors, and we had to contort ourselves in all kinds of different ways to just simply care for our residents, meet the demands of the families, and just survive, right? Just take it and survive. So, it was certainly, it continues to present itself as a challenging time, but I have a lot of hope that our industry really learned a lot from it, and we're ready to move forward. I know in many of our communities, families are coming back, and we want families to come back. We missed having that daily interaction with our families just as much as I'm sure our residents miss their family members as well. And so, we were able to do a lot of different things during the pandemic that were special moments, one of which was, we have a program called our Heart's Desire program, which is kind of like the Make-A-Wish program, where we typically select one resident and kind of make a dream or a wish come true. And we took that on and really started to do that across the board, just as a way to have some fun and make our residents feel special in these very lonely and dire times. And so, those are the types of lessons that we will continue to move forward with, and just continue to spread the good word that the senior living industry is back, and we are here to stay, and we are a good partner with with individuals and with the state governments that we operate under. So
yeah, and they're not scary places. They're great places where people thrive and get the care that they often so much need, and specialized care by people who are trained well. And it's just I love visiting specifically memory cares, because they are very warm. You feel the energy when you walk in, and it's just people who work their care, They care to be there. They care about their job, and they're well trained, and you could see the relationship, right? You walk in, you could feel it, so I thank you for doing what you both do. It's really excellent to be working with you. And I'm wondering if you have anything else to add or ask each other or ask me or share.
The only thing I just want to say to all of our consumers is just understand that, there was a lot of really scary things that kind of came out from a media standpoint through the pandemic that sort of overshadow what the phenomenal things that assisted living and skilled nursing facilities did through the pandemic. And so I want to just encourage a lot of folks to not be discouraged by those media stories because, and I think Paul touched on this, yes, we were ninjas, but we did a lot of really fantastic things. And there are a lot of success stories that came out of this. And when you're going to tour these buildings, ask, those administrators, like, what are you most proud of that you accomplished during the pandemic? And what was your biggest takeaway? How did you keep the staff motivated? Because I do think that you'll hear a lot of really fantastic, uplifting, and exciting stories that will overshadow some of the not so nice stuff that came out in press coverage.
Yeah, I think it's important to engage with the communities, with senior care advisors, and ask the questions that you might be really afraid to ask. You'd be surprised at the answers you get and examples of great outcomes and stories that will hopefully put families at ease at this time, right? Because it's, there could be a lot of guilt, a lot of fear, all the emotions, right, that come up with making such a big life decision for a loved one, or helping them to make that decision. And communication, right, is everything, always.
Everything.
Yeah.
Look at what we're doing here. This became a way for us to connect with families and tour them through our communities in the virtual world. And it's going to be a tool that we continue forward. I'll say one last thing, to hit on, the pandemic. We really honored those heroes on the front lines in the hospitals dealing with COVID, cases as they came in. But we all know nurses work in our centers too. And so, our caregivers, our frontline staff, our nurses, our program coordinators and food service directors and maintenance people, they were on the front lines too, doing everything they could to keep people's loved ones safe. And they deserve a lot of credit. They are the unsung heroes of this.
Absolutely.
This well.
Yes. Thank you for mentioning that. Absolutely. Okay. Well, if we don't have anything else, I will thank you both for being part of this and for being our partners, and working with our families and helping to keep them safe and cared for. And here's to a continued long and great partnership.
Yep.
Thank
was a
you,
pleasure.
Amy. Yeah, thank you to all the Care Patrol partners out there. Thank you.
Thank you so much.